It could be through that particular nga buhatan nila through smelling. Now, most exposure of humans to chemicals is via naturally occurring compounds consumed from, again, food plants. Humans are exposed to chemicals both inadvertently and deliberately. And 92% of all poisonings happen at home. Why do you think? Because the household products implicated, na nasa inyong screen, implicated in most poisonings are cleaning solutions, fuels, medicines, and other materials such as glue and cosmetics. But one of which, ang pinakadali ergid kaayo no makita sa mata are these cleaning solutions and medicines. Of course, fuels are kindly too harsh kayo siya. Of course, you are seeing yourself burning out. So most probably kanang isa ra kayarukan, usually they consume it through cleaning solutions or probably overdosing intake of medicines. Now, certain animals secrete a xenobiotic poison called venom. So, asa man lagi ka ng venom? Can you give an example of an animal, specific animal who is kuan ka nag-excrete of venom? Very good, snake. All right. So, usually injected with a bite or a sting as well. Mabitaw na ang bees are also causing stings, no? There are specific na mga animals nato that has their own categories as well. Let's for example, bees has also their families nga grabe ka poisonous. Na po yung mga bees nga they are tolerable, especially those kanang gakwaan natong mga honeys. But there are also categories under that nga or families rather na very kuan kanang fatal ang kalabasan sa ila ang stings. And other animals harbor infectious bacteria. Of course, we know that there are a lot of it. So some household plants are poisonous to humans and animals. So have you heard about a specific plant nga ginatawag nga espada? Hello, class. Have you heard about the espada plants? So, yes, they are part of the snake plant. So actually, because of this snake plant, actually they are good because they absorb toxins no inside the household. However, katong kanang ilaang leaves, I think they contain saponins, which is muna siya ang gakos og poisonous na substance when it comes to large na nga quantities. But ideally, it is mo lagi na if dili siya pasubraan, it's okay. But pag mapasubraan, diha na medyo delikado. So that is one of the example of some of the household plants. Um, just a recap, we already have gone through this. I will just let you read it by your eyes. So as you all know, before in India they have notes on poisons and antidotes also with the Greek physicians as well. Actually, most of our elders from different countries have their own, labi na katong mga very old na, they got to have the list of their own poisons and antidotes. So, of course, ay, okay, wala na sharing the screen. How about this one? Ay, okay. Wait. Okay, may gali nagsaba. Alright. So yes, these are also the ancient. Klaro na ba?
Yes, ma'am.
Okay, good. So these are the contributors of the list of those poisons and antidotes long time ago. So no, during the 50 to 400 AD, these Romans used poisons for executions and assassinations. So grabe ka brutal. However, since before, dili pa man get nga na gyud ka kuan kanang hectic when it comes to kanang mag-assess. So okay lang na anyway para mampuna siya sa mga people that are not doing good in our country. So pwede ra. However, actually right now, we already have laws nga gina-follow with regards even though even on the handling of these specific chemicals and even the plants itself. So there you go. So it was Spanish rabbi Maimonides writes the first aid book for poisonings. The title is Poisons and Their Antidotes. So there you go. So who is the father of modern toxicology? It's Paracelsus. Now he quoted in there, all substances are poisons. There is none which is not a poison. The right dose differentiates a poison from a remedy. So there you go. Now, why do they said if it differs only on the dosing of the specific drug or medicine nga makaingon ta nga kanisha it's already lethal, it's already fatal. However, this kind of dose is in line pa sa remedial or napay remedy nga makuha ang mga people. Because Bobita now we are learning on a specific calculation basing on the BMI of the patient because not a specific, for example, not my dose is kind of beneficiary for those people age at 7. Kay layo ra kayo. Layo ra kayo ang age, layo ra ang possible weight, layo ra ang possible nga even the ginatake na nga mga drugs. So we should consider it. Even gali, who among you here nakabantay nga pag moingon gali ang isa ka tao nga giubo ko bay gahi kaya akong ubo inom lang kog azit mo man gyapon ni grisita sa ako sa doctor last time. Can you really take the same antibiotic within the range of 3 months? As for example, let's put it that way. Within 3 months, kay tungod 3 months ago, gihutoy ka, mo gireseta sa imong doctor. Good nga, atong first nimo nga gihutoy ka, nagpa-check up ka, and you were prescribed a drug such as azithromycin. However, after 3 months, kay tungod kay grabe man kay kayumid, ang atong palibot, you were susceptible with still cough, hard cough. So, ketong mo may munaandan the first 3 months the last 3 months ago rather, nga giubo ka, gipaazit ka. So, karon after 3 months, giubo ka balik, azit gyapon ka. Kasi nakadungog naging nga scenario sa inyo Uy, wala. Wow. Okay, so I have I have patients encountered dili lang sa own drugstore but even during internship makadungog ko nga na mga people maghangyo sa mga PA nga mom, even though PAs know that once you got to have or the patient would ask you to buy kanang antibiotics, you really need to have kanang prescription. However, na mga kanang patients that brought of course that bought their kanang prescription with them like 3 months ago. Pakita dayon, hala ma'am, kuan man ni ma'am, kana mo man ni ginisita sa among doktor last 3 months ago. Well, let me tell you this: not all antibiotics which is taken within eventually within a year could be taken the same year. That is why physicians always ask, when was the last time you've taken antibiotics and what was that particular antibiotic? Because we are avoiding also unsa man unsa gina-avoid nato when it comes to antibiotic intake.
Antibiotic resistance.
Unsa? Sige, go. Yes, we are avoiding antimicrobial resistance. So that is why if you are going to encounter patients like this, especially on your internship, or even kani ninyo ang kalabay lang mo mga silingan nga na mga butika o niyang yiwan o ana, try, especially if the PA is not that oriented, and if you can try to of course be kanang mo sympathize mo na nga person, try to let them know na ma'am na reason nga nung kailangan ta mobalik sa tong doctor, especially when taking antibiotic. It's not the same thing na tungod giresultahan ta like 3 months ago, kay tungod maura gyapon natong gibati karon, maura gyapon na ang antibiotic ihatag, no, because we are avoiding antimicrobial resistance. So possibly if you will still give that the same antibiotic, especially the same dose, na wala na, ni katawa na lang ang mga bacteria, viruses, depending on what particular antibiotic and antivirals that was given to the specific person. So inga na siya. And highly toxic chemicals can be life-saving actually when given in appropriate doses. Poisons are not harmful at a sufficiently low dose. So we already had a short introduction with this. So yes, it's true. Everything that is been taken, if it is under recommended dose, that could really help out. But if it is not under recommended dose, well, come to think of it, it's either could mahypo ka, mahyper ka, o mamatay ka. So, ana lagi na siya. Now, these are some of the examples of the lethal doses of different chemicals. So, you can just take a picture or screenshot of this so that you will have a copy. And yes, by the way, I might not, or I'll think about it if I will send this PowerPoint to you. So there you go. So we have here now sugar is also part of the chemical, since it is a sugar xenobiotic. Hello, is sugar xenobiotic?
Yes, ma'am.
Okay, yes. For what reason? Because it is still under the source of, under the category of food. Now, well, we all know food represents the large, or yeah, the large exposure to xenobiotics. So there you go. So before, we had this what we call diseases of workers. Now, on this case, they are describing this kind of illness na one mascot as asthma in bakers, miners, farmers, guilders, tinsmiths, glass workers, tanners, millers, so on and so forth. However, this Italian physician, whom we call Ramazzini, Um, he outlined health hazards of the dust, fumes, or gases that such workers inhale, especially those that exposed you to this minute type of dust. So, the bakers and horse riders described by Ramazzini today probably be diagnosing or suffering from allergen-induced asthma. So, which is not nagpabilin on that day. Actually, it is still up to this point. They are still visible na illnesses in our society. So, the lung disease suffered by most of the other workers will now be classified as pneumoconiosis. So before, since we are not that kind of prone with regards to kind of naming of these kinds of diseases, but as we go further in the pharmaceutical trend, so we were able to classify those kinds of illnesses now. So the so-called disease of workers, which is described as asthma, is now being classified as what we call pneumoconiosis, which is a group of dust-related chronic diseases. So, labi na karon that we are before Gandhi ha, this was in the year of the 1700s. Naa na kali mga industrial nga mga gaka-build up, how much more in our modern days. So we should come to think of it. It's not just only the workers who were able or who are susceptible to this kind of illnesses, but also even those mga children outside. So mobita na ang pneumonia is not only particular to adults but also with kids. So there you go. So we also have this following physicians that also contributes in the field of toxicology. Okay, one of the most popular contributors before, as we all know, it's Paul Ehrlich. So he developed staining procedures to observe cell and tissues and pioneered the understanding of how toxicants influence living organisms. So these are the few people who contributed to our very known toxicology. So we already have gone through this also. However, let's just review. So we have different kinds of toxicology under the study. So we have Let's have first the environmental toxicants, which is usually found in air and water pollutants. These are substances harmful to the environment and to humans. And that is why, going back to the scientists who were crying in front of the TV, no, they were really telling us that our world is really dying, and we are the number one contributors of it. So come to think of that, that is so sad, no? However, environmental toxicants are both natural and, take note, it's man-made. Now, public perception that man-made ones are more serious than natural ones. Why? Actually, the reality of this is man-made made it more crucial, no? Because we cannot also deny the fact because sa kabright sa tao and even sa tungod kay mas gaka profound ang ka-bright sa tao, we want things to be convenient. Sakto ba? Kinsa may tao nga gusto maglisod-lisod. That even pag kuan kanang pag hindo sa salog, we made our own robots, di ba? We made our own vacuum nga robots. Where pwede man ta manilhig, but because we want to be convenient, we would like to make or produce a specific material or substance that could help us out. nga dili na ta maglisod-lisod as a person. Okay? So, 5,005 million yearly deaths worldwide due to bacterial toxicants. So this is, I think that was prior to pandemic. So how much more, no? Right after pandemic, unsa kaha ang rate na or ang stats when it comes to yearly deaths because of bacterial toxicants. So there you go. These are some of the examples. So many examples of diseases associated with specific occupations were recorded in antiquity, but they were not considered serious because of the health of the workers was not a societal concern. But you know what? These are some of the list of diseases that they got. Okay. So we all know that Miner's disease, no? It is based on the inhalation of metal vapors, foundation for the field of chemotherapy. And then we also have here tobacco and also the chimney or chimney sweeps. So workers typically are exposed to a greater number of carcinogens for longer periods of time. And especially nowadays, who among you here would like to work in an industrial company? Hala, wala. You don't want to be a scientist inside a laboratory. Wala mag-innovate sa inyo ah. Wala mag-develop og drug. Wala di ay. So okay. However, isa sa gakahadlukan sa mga tao, especially on the allied sciences na mga graduates is that once they got to work in a industrial setting, now they are exposed to, of course, these chemicals. However, actually, dili man gud ta mamatay diretso. We are not going to die. That is that easily. That is why gali na ay mga protocols, na ay mga standard operating procedure na gina-follow to avoid this kind of instances na pwede mahitabo. So, if you, like as a person, if you are not obedient to specific rules, to specific protocols, when there you got to have your own kanang way of taking all the possible nga mga sakit, no? So that is why do not be afraid. Even in hospitals, you might be prone to specific bacteria and all. But again, if you tend to follow the standard operating procedures, the protocols, the rules and regulation, well, of course, I believe you will be prevented to be more susceptible to these kinds of scenarios. So there you go. Now, these are some of the toxicology terms that we will be encountering more and more each lecture topic. So there you go. Toxicity, it means the adverse effects that a chemical may produce. Dose, it is the amount of a chemical that gains access to the body. We also have exposure, conduct providing opportunity of obtaining a poisonous dose. We also have hazard, and we also got also these threshold effects for dose. So we already had an introduction for the dose response relationship. So what is the other term for Noel? If you can remember. Can you still see my screen? Hello class, can you still see my screen? Is it moving or can you still hear me? Okay. All right, good. Now we have here the fundamental rules of toxicology. Okay. Ang screen, move ang screen on your end. So let me continue. Now, exposure must first occur for the chemical to present a risk. If you are not exposed to a certain chemical or substance, of course, you are not prone to any poison. So exposure is one of the first steps. Okay. Now, the magnitude of risk is proportional to both the potency of the chemical and the extent of exposure. And again, the dose makes the poison. Again, there is a specific dosing that can lead to lethal or fatal, or there is high toxicity in it, depending on the dose that will be introduced to a specific person. Now, these are the exposure concepts. Different toxic responses may arise from different categories. Could be under route of exposure, frequencies of exposure, and duration of exposure. It could be acute or chronic. Now, aside from that, we have here routes of environmental exposure. We have the ingestion. This is just a recap through water, could be water or food, absorption through the skin, and injection could be through bite, puncture, or cut. And lastly, inhalation through air. Chemicals are everywhere. And I believe you agree with it as a pharmacy student, diba? Everything in the environment right now is made of chemicals. Most less likely, nagali na to makita ang mga traditional medicines. Mostly, these are already synthetic yun. Mm. People who are exposed to chemicals by eating or swallowing them, breathing them, or absorbing them through the skin or mucosa. People can only protect themselves by blocking this route of exposure. Maubitaw ng in our laboratories, we are really gonna remind tano that always wear your lab gowns, to wear your proper gears to prevent any possible exposure sa mga lethal nga mga chemicals. So, if feeling na to sa high, especially the younger ones no nga, kanang mga char-char ang mag-mask, mag-goggles, well, it's no. You will later on realize it if you are already manifesting some of the symptoms. Sama sa kanang dali ra ka magluya, well, that's one of the manifestation of the possible nga symptoms. So, or you feel like you are drowsy, or you feel like lightheaded. So these are some of the symptoms. So for duration and frequency of exposure, these are also important components of exposure and contribute to dose. Now, acute exposure, we can identify it if it is less than 24 hours and usually entails with a single exposure only. However, if we have also repeated exposures, which are classified as subacute, subchronic, and chronic. For subacute, kindly take note, it is repeated for up to 30 days, subchronic repeated for 30 to 90 days, and chronic repeated for over 90 days. We also have just a review exposure concepts. We have the environmental, occupational, therapeutic, dietary, accidental, and deliberate. Now, let me ask you, at the age of our younger people, based on the graph, what age group is at great risk? You can comment your answer. One, yes. Okay, yes, it is number one. Now, on your own opinion, basing on the graph, can you explain why this group at the age of um, okay. Now, can you explain? Nakita pa ninyo kong screen? Okay.
Yes, ma'am.
All right. So, can you explain why is it under the age of one is most likely to be at the exposure of greatest risk? Why do you think? Okay. So, I want you on a one half sheet of paper to answer this graph questions and kindly pass it on our face-to-face meeting next week. So kindly have a screenshot on this. Okay. So individual responses can be different. The variety of responses among organisms that get the same dose of chemical is due to individual susceptibility. And those and individual susceptibility play roles in all situations involving chemicals, including those making medicine and caffeines. Now, going back to xenobiotics, now these again are called foreign chemicals which are synthesized within the body. And this could be naturally occurring chemicals produced by plants, microorganisms, or animals. Now, poisons actually are xenobiotics. Why? Because they are also a foreign chemicals. However, not all xenobiotics are poisonous. Why? Because our medicines, our drugs, if given in a recommended dose, well, they cannot be called as poison, but instead they can be called as cure or remedy. So, come to think of it, poisons are xenobiotics, but not all xenobiotics are poisonous. Now, how does the body prevent the action of xenobiotics? By redistribution, excretion through water soluble compounds, probably under the kidney and liver. Also, metabolism, which is the major mechanism for terminating xenobiotic activity and is frequently the single most important determinant of the duration and intensity of toxic response to a xenobiotic. Now, again, if a specific person, let's for example, given a specific drug, and that specific drug has, let's for example, CYP inducers, well, that also will affect the metabolism of the drug in the body and could be the reason of the retention. So take note of the number one and two. They are highly dependent on number three. So we must also consider that one all the time. Okay, this is how xenobiotics at work. Okay, sorry for that. Okay, thank you for letting me know. So, aha mo dapit walay nadunggan.
After
Kini?
ato, before pa na, ma'am. Before pa na, jud, ma'am.
Okay. All right. So, going back to this. So, before pa ani? Kani?
Dira, ma'am.
Mo ninyo last na dunggan.
O, wala last na donggan, ma'am. The next slide, anak, kay wala na tingo.
Okay. Ay, okay. Sige, thank you. All right. So again, this is how the framework of toxicokinetics is. So upon the exposure of the xenobiotic, it goes to plasma or tissue. Now, before going to the site of action. Now, upon the okay, kani madunggan ko ninyo. Wait lang ha. Very sensible ang mic. So there you go. So after the plasma, it could either be metabolized depending on the route of administration of the exposure of the xenobiotic. And then there it could manifest its therapeutic effect or mechanism of action before it goes out from our body. Now, usually, basing on the metabolism of the drug under phase 1 and phase 2, usually our xenobiotic is a composition of lipophilic or hydrophobic. Now, it should be converted to hydrophilic in order for it to be excreted from the body. So this is just an overview or a review rather of your metabolism. So under metabolism, it decreases biological activity and also it increases excretability. So as we all know, it is most less likely to be excreted if dili siya ma-convert into a hydrophilic substance. So there you go. How xenobiotics cause toxicity? So these are some of the reasons that our xenobiotics or synthetic substances causes toxicity inside our body. Now, usually, ang reason yun nga nung makakause ng xenobiotics of toxicity because they are disrupting our normal cell functions. So, let's for example, the normal cells functions this way because it also has its own sodium and potassium inside. However, since we are excreting these kinds of electrolytes in the body, we need to get replenishing or replenish. It needs to be replenished. So we are drinking synthetic sodium, source of sodium, source of potassium. However, you know what? These xenobiotics cause toxicity by binding and damaging proteins in our cell. Aside from that, it could also bind and damage DNA mutations. So inside your nucleotides is your phosphorus, your sugar pentose, diba? And then what else? It should be 3 parts so that it could be called as a building block nucleotides. Kaya kung duha ra sila, it is only known as nucleoside. So, what are the other nucleotides build up? What do you think? So, we have your nitrogen-containing base. So, kana siya phosphate group, katong nitrogen-containing base ninyo, katong pentose sugar ninyo. So, they can be interrupted as well during the entry of your xenobiotics once it is on its high doses. And aside from that, they also got to bind and damage lipids. So most probably, ang mga biomolecules inside our bodies, they are the first target of these xenobiotics that are already toxic. So they also react in the cell with oxygen to form free radicals, which damage all these three: lipid, protein, and DNA. Ang wala na din kay ang carbohydrate. So, these are types of toxic effects. These are only some of the few examples. Death due to arsenic and cyanide, organ damage due to ozone and lead, and mutagenesis through UV light, carcinogenesis through benzene and asbestos, and teratogenesis through thalidomide. So these are the most common target organ toxicity. First and foremost is of course your central nervous system because they are mas responsive sila actually. But aside from that, it could also be our immune system, liver, respiratory tract, even your eye because it is usually exposed to the light, especially the UV light. Aside from that is kidney through the metals, skin. Sa una, kaya diba mayroon sila nga, it's healthy to expose yourself around 7 in the morning to 9 in the morning Kay healthy pa ko na ang sun rays. However, right now, because our ozone is very destroyed, dili na to sure if until 9 pa ba ang healthy. Basin 7 to 7:30 na lang or 8. Because it is really quite kanang penetrating ang kainit. It's very kanang sakit na. So most probably it's not already causing us kanang healthy reactions towards our skin, even inside our body, but instead it is giving us crucial effects. So aside from that is your reproductive system. Now this is a run rough or kanang part sa toxicology under mechanistic 1 because this is how the chemicals cause their toxic effects inside the body. So as a pharmacist, future pharmacist, so nakachada ra gyud sa ato is because we can go through different kinds of fields, even under the field of toxicology. If you're wanting to be a forensic pharmacist, you're also dealing with the job of the toxicologist actually. So a touch of toxicologist na job. So toxicologists work to develop a mechanistic understanding of how chemicals affect living systems, such as developing safer chemical products, develop safer drugs, determine risk for chemical exposures, develop treatments for chemical exposure, and you got to teach not just your fellow colleagues but the younger ones. Why? Because on our modern days, these children are already exposed to different kinds of chemicals. For what reason? Because they can already saw it on YouTube, on Google, even on the TV. So, as curious as they are, daghan na sila mahuna-hunaan sa ila ang utok. Na, ay, pwede di ay ito siya. And you know what? In the US, gali, there are specific na mga teenagers who got, and I don't know how they get to have these chemicals, but they were able to provide themselves this certain poisonous chemicals, and then they use it as kana lagi katong mga more execution or assassination sa unang panahon, but they use it in their fraternities now. So that is so sad. Nadali na lang kay na nila makuha karon ng mga panahon na without thinking how humanity will get hurt. So no, we as a future lecturers, we need to really impart the knowledge and the understanding of how these chemicals work in one's life. So these are we also gone through this during the prelim. So these are the different kinds of categories of the toxicologies. Under mechanistic, it studies how a chemical causes toxic effects by investigating its absorption, distribution, and excretion. Now, they often work in academic settings or private industries and develop antidotes. So, karon, kung sa unang panahon, like 10 years ago, 15 years ago, it was the activated charcoal, which is the universal antidote, like way before. But right now, we have modern developments when it comes to antidotes. Natin mga specification. Well, activated charcoal is still in the market and it is still known to be effective. However, there are specific na mga antidotes that is treating specifically this kind of toxicities on these specific substances as well. So aside from that, we also have descriptive toxicologists, which evaluate the toxicity of drugs, foods, and other products. Now, they often perform experiments in pharmaceutical and academic setting as well. We also have clinical toxicologists. Usually, these are physicians or veterinarians interested in the prevention and diagnosis and even in the treatment of poisoning cases. So if you want to be the reason of people not getting on the verge of being toxic, now let us help out. If you want to be a clinical toxicologist someday, then please do so because it will really help the people. No, okay. Some of the people are not yet that oriented with regards to specific poisons within the area. So it would really help out. No. So aside from that, we also have the forensic, toxicologist, environmental, regulatory, so on and so forth. So just a review before we got to end. So what time is it? Okay. So again, toxicology is its main object is to establish safe doses and determine mechanisms of biologic action of chemical substances. And there are different kinds of career in toxicology. If you want to proceed, then it would be better. And lastly, hello, can you hear me? Hello? Okay. So again, animals in research, they are under U.S. public health. Actually, we all know that mice are are really usable in terms of research. But you know what? Um, I also read a literature about on how mice needs to be handled. No, it's really even though through these animals we have developed or achieved a lot of dependent directly or indirectly research, especially on drugs. However, naa day mga particular nga nag-arouse po ng mga cases na because of the mishandling of this mice, they also cause or the transfer of, as we all know, no, because it is a family of rat. So they are also causative of this poisonous bacteria or toxicants. Now, toxicology or environmental health sciences is a hook to interest our modern students and kids on learning more about how does specific xenobiotic could help or could be the source of crucial effects towards a specific person's life, you know, how it will affect one's life ahead if it is not dili siya nato ma-maintain or dili nato ma-follow what was given to us or rules given to us by specific position, or we are mishandling on how to take it or how to use it. So nga na nga mga kuan factors. So I think that would be all for today's lesson. However, I want you to study this one because um, I think, do you have classes on Friday evening, like 6 to 7? Wala may class 6 to 7 on Friday. Yes, Ray.
Naami mo
Naamoy?
reporting sa kumain
Ah, okay. How about on Saturday?
evening ma'am.
Um, we can have it maybe 4 to 5 in the afternoon. Online na gyapon.
Naami ano mi yaon.
Ay, kadokyaon. Oh, what is your free time na lang on Saturday? 3A and 3B. It is just an hour.
Pwede rin road trip ma'am kahit Saturday night.
What time, Ray?
Mga 6 to 7 p.m. onwards.
6 to 7. Okay. So we will only got to have a quiz on that day. So for 3B, okay, about 6 to 7. 3B, okay ra? Silence means yes. Okay, so 6 to 7. So kindly review whatever you got right now, and then I will also be posting notes for list of toxicants, and then kindly study also that one. I think that would be all for today. Do you have any question? None?
Done ba?
Okay, so see you on Saturday, 6 in the evening for a quiz. Okay? Thank you very much, everyone. And balik na tao face to face next week. Thank you.
Bye
You
ma'am.
may now. Bye.
Thank you, ma'am. Thank you, ma'am.
Bye ma'am.
Bye.